Hello there. How are you? Good. I was waiting for you. How are you doing today? Good. Okay. Well, you can take a sit. I'm gonna get started here, and I'm gonna go through a few things first. I do have your profile here, and you're coming here today for an ear exam. Most likely an ear cleanup, and just to make sure, you were in the ER 2 weeks ago, and due to your accident you've been experiencing some diminished hearing and some ringing in your ears. Okay. Yeah. Well, as you may have been told, this is normal given the accident that you had. And so what we're gonna do today is just, I'm gonna examine your ears, make sure that there's no redness or they're not swollen, and we're gonna clean them up. Okay, good. One thing you need to know though, the ER that you've been to had a lice outbreak. So I have a note here to let you know that I will examine your scalp, if that's okay with you. Alright, yeah, it happened actually a few days before you went there, and it was detected a few days after you left. So, alright, if you have time and that's okay with you, we can get started, okay? It won't take that long. Alright, good. Okay, let me get ready here. I'll be with you in a minute. By the way, just to let you know, that clock behind me, it's not working, and I wanted to let you know because some patients have seen it, and they freaked out about time, so it's not working. Just letting you know. Okay. So I heard you had a pretty good recovery after the accident. That's good. I'm glad to hear that. Alright, I put this on because I'll be very, very close to you. Okay? And what I'm gonna do is I'm just gonna place my hands on top of your head, and I'm just going to look for anything on your scalp. You mentioned you didn't have any itching, but when you have lice at first you don't realize until it becomes worse. So just gonna get started. Your ears in pain right now? Okay. Have you experienced any diminished hearing that you've noticed over the days after the accident? Okay. Oh, that's good. Like I said, ear ringing is very, very common after an accident like that, so it's good that you schedule this appointment anyway. You always want to make sure. Well, you do have a dry scalp, but other than that, I don't see any sign of lice. There's definitely no eggs. What shampoo do you use? Okay. Yeah, it's just a little dry, that's all. Do you use conditioner? Okay. you ever experience any itching from dryness, then I would try changing the shampoo. Alright, I think you're clear, which is good. We had some other patients coming yesterday from the same hospital and they did have lice, so you're lucky. Okay. Alright, we're going to get started soon. Going to grab my otoscope, and what I'm going to do first is going to look at each ear individually, and we'll going to determine if there's any inflammation, and then we'll proceed with the cleanup. Okay? Alright, give me just a minute, I'll be right back. So this is the otoscope I'll be using, and we're going to start with your right ear. Please let me know if you feel any discomfort, okay? I will determine to see how much ear wax buildup you have there, and hopefully we'll see if there's any redness. You may feel a little pressure, but just let me know, and I'll stop. Here we go. Does that hurt? Oh, okay. I don't see anything out of normal. You do have some wax, but we're gonna take care of that in a minute. I don't see any redness. Okay. Right here seems to be okay. Check the left now. Just out of curiosity, are you under any medication right now? Okay, do you know what that's called? Okay, no worries. Would you mind if I take a look at your eyes real quick? Just want to check your pupils, if that's okay. Okay. Just gonna shine a light, and if you can please follow it. Okay, just follow the light. Alright, that's good. Just checking. Thank you. Alright, let's move on to the left ear. Same here, please let me know if you feel any discomfort. Okay. Alright, here we go. Looks very similar to your right ear. A little more wax on this side. Nothing too bad. Do you use cotton swabs yourself? Okay, I know the doctor probably told you not to use them for now. Just until this checkup is you can push the wax behind there's nothing out of the normal there. No redness, no swelling. That's good. So we're gonna get started here. This will take a little while. And again, I'm going to start with your right ear here. And you again may feel some discomfort. If you do, just let me know. There should be no pain though, because there's no inflammation. But give me a minute. I'm gonna for the cotton swabs and we will get started. Okay? Thank you. Swabs here, and I'm going to clean my hands first. Do you have a busy day ahead? No? What are you planning to do afterwards? That's good. You're gonna rest some more? Yeah. Guess you still have some days off after the accident, huh? That's good. You should get plenty of rest. You being able to sleep well? Okay. Well, you can get plenty of sleep after this. Okay. Let's get started. I'm gonna go with the right ear first. Gently swipe this ear a little bit on the outside. It's a little cold. Okay. Making sure it's very clean on the outside and before we begin. You comfortable? Good. All right. Okay. If you can lower your head down a little bit. Okay, that's good. Thank you. Let's get started. That's good. Have you had one of these before? Yeah. Yeah, some people find it relaxing. I don't blame them. I enjoy them myself. Unless there's pain in the ear canal, of course. But there's always ways to numb the pain. I'm gonna grab a different one. Make sure we're working clean. Okay. use earbuds a lot, or headphones? Okay. Yeah, that would cause. It always helps with the ear wax buildup, loud music, and having those plastic earbuds inside your ear canal. Sometimes people take it for granted. Clean outside again. Very good. Yeah, no pain, no discomfort. Okay, that's good. Alright. Just changing the cotton swabs so that we're working clean. We're almost over in this here. Don't worry. If you can look to your left, please. There, so I can. Does that hurt? Okay. Okay, we're almost over. Almost done here. Good. Alright. That's good. That one's done. Going to clean the outside area again. We'll keep going on the other ear. Okay, good. That's looking good. Alright, so that's one done. Let me clean my hands again. And I'll continue to the left arm. Okay? Alright. Okay. Okay, this was done before, but just in case, let me check your glands right here below your neck. You don't have any pain swallowing, right? That's good. Okay. No sign of inflammation, that's good. Just wanted to make sure. And we're gonna move to left ear. Alright. Same as before. If you feel any pain or discomfort, let me know and I'll stop, okay? Alright. avoid pushing anything back. Is that better? Is that better? Good, thank you. Change skin. Clean the outside here of the ear. Yeah, it's a little cold, sorry. Okay. Can you move your head a little to your right? Okay, thank you. Okay, we're almost done here. Pretty glad you don't feel any discomfort. Makes this a lot easier, doesn't it? Okay. Well, just one more time. Let me clean outside again. And then do the final one. Good. Thanks for being patient. Okay. So I would recommend that you don't use any earbuds for at least 2 days. Okay. And do not try to clean your ears yourself for now. No cotton swabs. Just let it be for 2 days. And if the earring goes on after 3 or 4 days, definitely give us a call, let us know, okay? There's nothing visible on the ear canal that may be causing it. Sometimes when we're exposed to very, very loud noises, you can hear it for a while until the ear heals itself. Just go and do some self-repair. Alright. Let me clean one more time. Alright. So I'm just gonna look at your ears again with the otoscope real quick, okay? Just to make sure everything's right. Now that it's all clean, you can get a better look. This one looks good. ears are gonna feel a little cold for a while. Don't worry about it. Alright, so everything's clear. There was no inflammation to begin with. There was inflammation to begin with. You're doing alright. So hopefully that ear ringing will just going to go away on its own. And like I said, let us know if after 3 or 4 more days it keeps happening, okay? Maybe we can set another appointment. And everything looks good right now. Alright. Well, I hope you get some good rest after this. And everything should be fine. Like I said, let us know if the ear ringing continues and we'll take another look at it. Alright. Well, thanks for dropping by. Very sharp time. And for being such a good patient.